Dear students, it is the second video for the week 13, and in this video we are going to talk some of the statistics by the World Health Organization about the health situation in Pakistan and a little bit about the health policies and systems currently prevailing in the country. In the previous video 1, we came to know that health issues, just like the other disasters like natural disasters, can affect the economy and the people of the country directly. Yes, they do. Health primarily is a sustained, proper natural function of the human body, whereas the disease is an intrusion by some external factor or some internal issue that misfigures or sometimes breaks that system and compels the body to react otherwise. Well, diseases impact worst because they cost money and they also create some social implications, like people when understand about some person, they keep distance and they are hesitant to see, and this is really a problem. Whereas the good diet and proper medications is the possible solutions. Well, according to World Health Organization, Pakistan is among those nations where the health issues are common and people often face multiple diseases, double burden of the diseases. Clear means besides one disease, they are attacked by different diseases and thus they brutally affect the immune system and the people pass away. For example, in the recent COVID-19 coronavirus, the people who had already suffering regarding other diseases like tuberculosis, diabetes, uh, liver issues, some of the kidney problems, like they couldn't survive when that virus attacked because that virus directly hit them on their weak areas. Fine. So thus you understand that once a disease happens in the human body, that not just affects on one, but it endeavors to affect on the other vital parts. For example, in Pakistan, hepatitis A and C is very common. Pakistan is the fifth highest or the largest tuberculosis country. Here, due to the geographical locations and the regional traits, like in monsoon, rainy seasons, malaria breaks out and HIV prevalence is 21%, and Then other diseases are spreading due to the unscreened blood transfusion, means the blood which is injected to the people in the critical situations, that is not that purified, and the antibodies transfer from affected blood to the other bodies, and then resultantly those germs find a new life. uh, Similarly, drug resistant tuberculosis, it is the disease of tuberculosis that once you have treated and not completed the course, for example, doctor asks you to take medicine for almost 3 months, and the patient just uh, takes medicine for a month and then leaves this medicine, clear, then within months that disease, mean tuberculosis, attacks people, and that attack is worst, and at this stage the ordinary medicine doesn't uh, matter well. So this is called drug resistant tuberculosis. Fine. uh, then according to United Nations, non-communicable non-communicable diseases along, for example, injuries and mental health are now another issue. As I in the first video explained, that according to a careful estimate, that because of the social inequalities, economical pressures, and other complications in Pakistani society, hypertension, anxiety, frustration, they are the common diseases. Well, Pakistan is ranked 7th in the world for diabetes prevalence, whereas hypertensive issues are found more in the young people, and that is mostly related to taking smoke or tobacco, clear. Then blindness is another issue that is increasing in the public, usually using of the cell phones, sitting in front of the computer screens, clear. Similarly, children are facing diarrhea, respiratory illness, mean the problems of related to breathing, clear, lungs, they are the major killers, and then the problems of women, clear, then cancer. These are the common diseases which happen in Pakistan, and they are causing lots of issues. Well, the health system of Pakistan is designed into two systems: private sector and the government sector. Plus, the government sector, uh, 8 federal units, including provinces and administrative areas, have been designed according to the 18th constitutional amendment in 2010, in which it was decided that the health sectors should be improved. In government sectors, there are hospitals, dispensaries, laboratories, that at every district level we find a general hospital. For example, in Rawalpindi, you find two major hospitals. Benazir Bhutto Hospital means the old central hospital, and then in Raja Bazar, the district headquarters hospital. And similar hospitals are found in all the major cities. But the advanced hospitals with the latest technology are found in Lahore, Faisalabad, Islamabad, Rawalpindi, Karachi, Quetta, Peshawar. Fine. But unfortunately, not all the people can approach them directly. Yes, in organization or the public sector, Pakistan armed forces have sustained a very good repute by establishing uh, appreciable health organizations, and all the forces have exemplary discipline, trained medical staff, doctors, nurses, well defined equipment system. Clear? CMH, Air Force, hospitals, naval hospitals, they are available. Although they were primarily uh, introduced to help out the armed forces, yet they are equally contributor in the service of general public. Fine. And often their market rates are little bit less than the private rates, especially in the country like Pakistan, where the pandemics and endemics and natural disasters are very common. Pakistan armed forces have always played their very important role in providing the ur- urgent medical assistance to the people, like in the earthquake 2005, relief operations in every flood stricken area, plus whenever they are recalled. Well, in primary health sector in Pakistan, almost 7,500 first level care facilities are available. More than 1 lakh ladies health workers are providing the people with basic health assistance. Under the government of Pakistan, several health initiatives like polio reduction program, primary child care, uh, women uh, protection during the delivery, plus the awareness about the blood cancer. These are the common services which are being offered by the government. Now come to the private sector. Yes, private sector in Pakistan is more flourishing because of increasing population and increasing in number of diseases. The health sector by government cannot cannot afford this burden. Reasons are the low budget and other lack of infrastructure. Yes, private sector is very much there. Good doctors are being produced, better health equipment they have, plus they have well trained paramedical staff. Yet there are certain drawbacks which have created lots of tension in Pakistan, and those factors are due. Number one, the doctors which are working in the government hospitals also have opened the private hospitals, and they are complained not entertaining the people properly in the government sectors. Number two, the medical diagnosis in Pakistan is all controlled by the private sector, and they uh, are providing diagnosis, mean like X-rays and MRIs and others on very high rates. Secondly, their results are not accurate. Means if you take a test from one laboratory, they give a different result, whereas the other gives the other result. Then the medical companies, pharmaceutical companies also have the monopoly, and they increase the rates, tariff in the medicines. Plus, some of the companies have been reported to selling out substandard medicine, which later on revealed have created lots of adverse effects. Government took very strict action. Yet, these companies cannot be curtailed properly over because it is being run by the mafia. I hope that you have understood this, but at the same time, we should not miss another issue, that is the alternative medicine. These hakims and these homeopathics, clear, and the others, local bone setters. They are also the silent contributors. Some are doing very good, and they should be provided proper uh, financial assistance and legal assistance, whereas some are really not good, and they are looting the people, and they are destroying and creating a very strange kind of confusion in the health sector. They should be controlled and curtailed properly. Thank you very much.